Hi everyone. Thanks so much for joining. It's a pleasure to have you here today. We'll be focusing today on the role of community health centers and the role that the county health department plays in a community.
The broadcast is now starting. All attendees are in listen-only mode.
Hi everyone. Thanks so much for joining. It's a pleasure to have you here today. In today's webinar, we'll be focusing on the role of community health centers and the county health department. The predominant focus of this webinar will actually be the role of community health centers, which are basically a direct outcome of a combination of federal, state, and county efforts. With that in mind, let's get started. The lines will be muted for the duration of the webinar. Then at the end, we'll open up the lines for a 30-minute question and answer period. All right, let's get started. Okay. Okay, so the topics we'll be covering today are as follows. First, we're going to take a look at just a brief overview of what health centers are. Okay, snapshot, bird's eye view of what health centers are. Next, we'll take a look at some very basic program requirements. Following that, we'll take a look at some variations of health centers. There are a lot of different types. Of health centers. Each one focuses on a specific socio-demographic area. Next, we'll take a look at some of the required services that health centers provide. And then finally, we'll look at the benefits of a federally qualified health center, an FQHC. So again, we'll be taking a look at an overview of the health centers, the program requirements, variations of the health center system, variations of health center models, some of the required services that health centers provide, and the benefits of federally qualified health centers. So let's first take a look at a basic community health center model. So the general outline of community health centers, or CHCs, first, they are community-based. They are a company with a community-based focus. They're a health center with a community-based focus. Each health center is run by a board of directors, which by statute is made up of at least 51% that actually use that clinic. In addition, they typically provide comprehensive services. The services will consist of core primary and preventive health care, and the services are typically supplemented not only by dental and behavioral health, but also by enabling services such as transportation, translation, outreach, and any other social services that may eliminate barriers to care. Again, there are a lot of different varieties of health centers. Each version of a health center has its own services that they offer to eliminate those barriers to care, depending on what their socio-geographic focus is. But on an overall level, they provide core primary and preventative health care, and they're supplemented by dental and behavioral health. In addition, they supply services that eliminate barriers to care. Additionally, overall, the health centers will be will provide culturally and linguistically competent care. The health center will offer signage, as well as access to interpretation services and health education materials in multiple languages. Again, depending on the culture or cultures of the community they're serving, the languages spoken in that community will determine what particular languages the information is offered, what the services are offered. In addition, they typically provide high quality of care. The quality of care that's provided through the health centers reduces hospitalizations and emergency room use. It reduces annual Medicaid costs, and it helps prevent more expensive chronic disease and disabilities. So these are, in a nutshell, this is an overview of regardless of the version of the health center. This is an overview of what the health centers typically offer. Again, they have community-based focus. They offer comprehensive services. They provide culturally and linguistically competent care, and they provide a high quality of care. Now let's take a look at FQHCs. What are federally qualified health centers? So there are two types of FQHCs. There's a Section 330 grantee. This is from one of the sections of the Public Health Services Act, where the federal government provides funding for health care. So FQHCs can also be known as Section 330 grantees. They're funded through Section 330 of the PHS Act. In addition, there are FQHC lookalikes. These are not actual Section 330 grantees, but they provide the same services. Typically, they provide the same services as an FQHC. All FQHCs are private, regardless of whether it's a Section 330 grantee or an FQHC lookalike. They provide charitable taxes. They're all private charitable tax and nonprofit organizations. They're public entities. They're 330 grant-funded community health centers. They're funded through the Department of Health and Human Services. Initially, they were referred to as neighborhood health centers, which was basically an outgrowth of President Johnson's Great Society program in 1966. This was the beginning. This was the seed stages of the FQHCs that we have today. And in addition, they're mandated to provide care to anybody seeking health care. So again, there are two versions of an FQHC. There are Section 330 grantees and there are FQHC lookalikes. They're all private, charitable, tax-exempt nonprofit organizations. They're all public entities. They're all 330 grant-funded community health centers. They're all funded through the Department of Health and Human Services. They're an outgrowth of the neighborhood health centers that were launched in 1966 as part of President Johnson's Great Society program, and they're mandated to provide care to anybody seeking health care. Now, we're not going to get into too much detail on this, but the key documents are the Consolidated Health Center Program, which would be Section 330 of the PHS Act, and there are going to be the program regulations. And then there's the BPHC Policy Information Notice, the Health Center Program Expectations. Okay, these are the three key documents of every FQHC. Now, let's take a look at some of the program requirements. Okay, some of the program requirements of a federally qualified health center. FQHCs have to provide either directly or through contract or established arrangements the following: all the required primary and preventive services, supplementary services including referrals to other providers, can be specialists, can be any other health-related services, can be substance abuse, mental health services. The FQHC has to provide all those supplementary services. Case management services, which basically consists of counseling, referral, and follow-up. Seems to be the case, and any other services designed to assist patients in establishing eligibility for the health care or programs that provide financial assistance. They have to provide enabling services including outreach, transportation, and translation. They have to provide education regarding the availability and proper use of health services. And then in addition, they have to provide health services as appropriate, which can include behavioral and mental health and substance abuse services, recuperative care, and environmental health services. So again, all FQHCs have to provide either directly or through contract or established arrangements all required primary preventive services, supplementary services including referrals to other providers and specialists, and health-related services, which can include substance abuse or mental health services, case management services, counseling, referral, and follow-up, and any other services designed to assist patients in establishing eligibility or programs that provide financial assistance. It could be any safety net programs. Enabling services including outreach, transportation and translation, education regarding the availability and proper use of health services, and additional health services as appropriate, which can include behavioral and mental health and substance abuse services, recuperative care, and environmental health services. These are the required programs of every FQHC.